Well, welcome to another Cutting Edge show. I am one of your hosts, Omar Neal. I'm the former mayor of Tuskegee, Alabama, and host of the You Got the Power radio talk show. Well, today we're going to have a wonderful show. The show is being brought to you by none other than the University of Maryland School of Public Health. You have joined us on the Cutting Edge, where we discuss all things health and wellness, COVID-19 and beyond. We are so appreciative to have you with us today as we discuss this issue of trust, a calculated risk, an honest conversation on how trust and trustworthiness are essential elements in addressing health disparities in America. We are going to really drill down into this issue of trust today. And I'm so excited to do it with my dear friend, none other than my co-host, Dr. Stephen B. Thomas. We call him Dr. T amongst these parts. He is professor of the University of Maryland School of Public Health and director of the Maryland Center for Health Equity. Hey, Dr. T, how you doing, man?
Oh, it was a beautiful day today. I even ventured out into the wild and went to meetings on campus
In person?
people in person. I walked in the room all excited. We're in person. And there was a sense of heaviness in the room.
Wow.
Even walking in the halls, people not making eye contact.
Yeah.
I think there's, while we're glad to have the mask off, while we're glad to, kind of be back out, I think there's an anxiety hanging over things that people need their spirits lifted.
Yeah. Well, it's a whole lot of things. This is kind of the aftermath of a storm. It's still, the storm is gone, but the what is left in its wake, right, is still we're dealing with, right?
The wreckage.
You lost your house and everything. So, but the storm, you say, there's no more storm, but think about what all the damage it did. So,
and Mayor, Mr. Mayor, we have lost life expectancy. That's huge.
Oh, absolutely. Yeah, go ahead, Dr.
Well, I'm just recognizing that while it's the storm is over, we're at a very high plateau when it comes to people still suffering from COVID. But it's the loss of life expectancy and the orphans, not only around the world, but right here in the United States. So we have to figure out how to keep the conversation going, even with the heaviness,
right,
and get people to be encouraged. And that's what happens whenever I come on the show and get all the messages from the wellness warriors out there.
Yeah.
They're doing things that keep their spirits up.
Absolutely. And we have not talked about as much as we should, and we will in the coming shows, the whole long haul COVID and its impact on many things, to include, just our mental, capacity has been diminished. Many people who've had COVID, they suffer from sluggishness, memory loss, balance issues. We are still reeling with this, and so this is something we got to take into account and try to figure out some way to make some adjustments.
So
Mayor, as a world.
Let me just say before this introduction, at any time during the pandemic, I know more people now in my individual personal network who's had COVID than ever before in the pandemic.
Yeah.
So it hasn't gone away. That's why we keep the show going.
Right. Let me on a sad note, my mother's best friend in the world, my mother passed 2 years ago, last month. But her best friend in the world passed day before yesterday of COVID. And, 96, she would have been 95, 96 years old, somewhere in that area, and lived a long life and died of COVID. Now she had her shots, and obviously there were some pre-existing challenges she had.
Right, we get it.
But COVID is still killing people. We're talking about 500 plus people daily die from COVID, and we shouldn't think that's a small amount of people.
No.
That's still a lot of people that's
Big
dying from
time.
COVID, right? And we also have to boost the booster, Dr.
There you
T.
go. They're
You know,
out.
we
They're
got to talk
available.
about, you got to go right now, 12 and up, can get the booster shot. So we got to get them to get the first shot first. We've not done that well. And then they got to get boosted, because that's the best way to weather this COVID storm.
Indeed.
It's to be vaccinated, right? Okay. Well, Dr. T, we can't do this without telling you who's behind the scenes, the team behind the scene.
There you go.
Headed up by our illustrious technical director, Meg Jordan. She's assisted by Maggie Daly and Saraya Khan, who is our social media and communications guru, and of course, Elijah Pugh Jr., sound designer. So we're in front of the camera and people see us all the time, but they don't see the people behind the scene. Meg comes up in front of the scene. She does our public health minute, but she heads up the back end of everything, the technical part. Don't forget that you can really connect with us on all of the social media platforms: Facebook, YouTube, Instagram, and Twitter. And you can like and subscribe and share what we're doing each Thursday, every other Thursday, basically.
That's right.
We're doing the show, and we always have something that's going to be powerful, something that's going to truly inform and enlighten you. That's what we do here. Don't forget, you can subscribe to our newsletter. That's the QR code that you can use. But each week, whether or not we are on or not, we put out a newsletter that gives you the previous show, as well as excerpts from previous shows, as well as just information about health and other issues that are very important. And so it's a really, really good, well done newsletter that our people behind the scene put together for you. Absolutely. Each and every week. So
even our reruns are good, aren't they?
Oh, absolutely. I watch them, so I don't normally watch reruns, for 31 years, you don't do it, but I even watch the reruns because they're wonderful, good. Well, some sad news today. The Queen Elizabeth transitioned today, and so our prayers go out to all of the people over in UK, and we know that being the longest reigning queen, right?
Wow.
Since the 50s, man, that's a long time, and so our hearts go out to all of those over there and to the world, because when you have someone has that statue, you certainly want to give deference, right? To people who hold such high esteems. They long live the queen, right? And so
I have to admit, I learned most of what I know watching The Crown, right? But it gave a deep insight into the personalities there. So yes, let's honor and recognize that kind of leadership at a time when the world is in chaos.
Right. Okay. Right. Maybe, sometimes, there's a blessing and a lesson in everything, Dr. T. Maybe this will settle us a little bit and we won't be so partisan, and maybe this will give us an opportunity to just take a respite from all of the news cycle of all the things that's happening and focus on something else. Let's look at her life and her contribution to not only England, but throughout the world.
Absolutely.
So that's a good thing. On another note, a good note, this guy that's in your neck of the woods.
Can you believe that?
Down here, man, Francis Tiofo, who's now going to the semifinals, man.
Can you believe it?
Yeah, man, the first since 2006, first male American to go to the semifinals since 2006. That's a long time.
Just happens to be an African American male from Hyattsville, Maryland, right down the street where the Shop Spa City's in Hyattsville. Can you believe that?
No doubt about that. The other thing is too, Dr. T, he did his stuff at the public places there, right? And so those, this YMCA's and all of these, and we had the guy that was over all of that stuff too on at one time. That the recreation part.
That's right. Parks and Recreation.
Parks
right
and
here
Recreation.
On the cutting edge. That's right.
On the cutting edge. I bet you he was probably a part of that organization as well. So we are really happy. We hope that he goes all the way and win the whole thing, man. So we are watching with bated breath, hoping that he gets this thing. Okay, this thing going on. Dr. T, we find it important to just stop and talk about issues that matter and try to broaden the context. When we were talking about trust as a calculated risk, meaning that trust has to be basically earned, and so the person has to have a reason to trust. And I think sometimes we ask people to trust without showing and sharing with them how the people to whom we're asking to trust, or the institutions, basically, we're asking to trust, are trustworthy. And I think if we focus on the fact of trustworthiness, then trust will follow, right? If we can articulate whether or not something is trustworthy. And what I find is that disappointment erodes trust.
There you go.
And disappointment is merely unmet expectations.
Okay.
Right? So that's why we need to continue to talk about that. And so when you have a people who have been disappointed over years, hundreds of years, right? It's hard for them to trust.
Hard.
And think about this, Dr. T, and then I'm gonna bring some other people on. If I don't trust the healthcare system, then I'm less likely to go get my regular checkups, right?
That's right.
I was always told an ounce of prevention is worth a pound of cure.
Yeah, I remember that too.
You remember that, right?
Yeah.
So we wait till we're about dead to go to the doctor, right? And then the doctor says, you got so long to live, man, because we didn't go, because we didn't trust. So there's a direct correlation between health disparities and trust.
Okay. And you did that in the context of the medical system. Now imagine if you live in Jackson, Mississippi.
Oh, wow.
And you can't drink the water. Or in parts of Baltimore, right here in the state of Maryland. That's the public health side.
Flint, Michigan, don't forget about that.
And Michigan and Flint. That's the public health side of the equation. And that's the space that we're in, that intersection between the public's health, the common good, and our clinical healthcare delivery system. We're going to try to bridge that gap. Even as they retreat, we're still committed to bringing our pop-up clinics into the community. And we have several of our wellness warriors that have events coming up. They'll talk about it over the course of this evening.
Oh, absolutely. And but let's bring up Dr. Carol Ritter. Dr. Ritter has been part of the team for since we began. I don't even know if Dr. Ritter started with us, but certainly she's been a part of it. She's an gynecologist, and she hails from the Maryland area, so she's
city of Baltimore.
I mean, you're the Maryland people, man. What's with y'all?
We call us the Free State.
Hey, Dr. Ritter, how you doing today?
It's good to see you. I miss you.
Hey, I miss you, Dr. Ritter. I just want you to know that, right?
Oh, that's sweet. I miss you too.
I miss you honestly, so much. I even went to get some glasses like you so I could remind myself of you.
Dr. Ritter brings our State of Maryland Medical Society to the table.
Yeah.
And the conversations that we have here on the cutting edge back to their tables. And I think we're moving the needle. So you're on the front lines in your clinical setting, Dr. Ritter. You see what's happening out in your world?
Yeah, and people are coming out of their Zoom boxes, and starting to reconnect with each other. And as you saw, Dr. T, today in your own world, there's like a disconnect, even though we're connecting together out of these Zoom boxes, because you know what? the world is a different place.
That's right.
Wow. Right.
And people don't recognize each other anymore. And there's the trust too. You don't know who's, we've changed,
Right.
the system has changed,
Right.
and we don't know where to go from here. Like, so we do need, some direction and some leadership. I think that these cutting edge boxes have really helped me immensely, because I see the community effort in a different way than I see the hospital and the biologic health effort. So that intersection is a friction, which is uncomfortable, but it's also a huge opportunity for us who have like really had, I think you pumped everybody up with these in a way that has been very useful, in a trusting way, because you've been here consistently. And I'm looking forward to getting out of these Zoom boxes and actually meeting all of you guys sometime.
When you think about it, Dr. Ritter, you're correct, because we are creatures of habit, one, and once we get into a pattern, it's hard to get out of it. But I think our interpersonal skills have been, in some way diminished, because we are not looking people in the eye face to face, right? We seeing each other through cameras and that kind of thing, but we're not spending that, being in the presence of people. And it's a different experience being in their presence than being on in a Zoom box, as you put it.
Yeah, I mean, most of the meetings that I'm in now are have been on Zoom, and I haven't met most of the people. I don't know if they're taller or shorter than me or whatever. You see them from here up, right?
Right.
And so that's an uncomfortable situation for. I mean, I'm more of an introvert than most, so I've enjoyed it to a degree because allowed me to do
tell the
things that I
truth and
probably
shame
wouldn't
the
have done
devil,
before.
Dr. Ritter.
Yeah, like I would have never been in a black barbershop before, right? Or a salon, right? So yeah, I'm doing things differently, obviously. So that's
there's
a good thing.
a lot of silver linings. But one of the first steps to get back to community is empathy. And in the meeting today, I realized how much information you lose when everyone has a mask on. It's one thing when you have trust and you walk in, okay? But it's another if you really don't know everybody or where they're coming from, a lot of information is lost. And so in that face-to-face meeting, I found it really challenging. So Dr. Ritter, I think you're onto something with our skill set, and we need to figure out how to come back together. I think by keeping the conversation going in a way that we are here in the cutting edge and in the shops, they're doing it in a way that is not oppressive. They're doing it in a way that's saying, here's the information, we're going to help you carry it out. And I think that's the other thing we have to do. Make sure that we help people carry out the very new reality that we're in now and help them navigate it.
Something interesting, Dr. T, I hadn't thought about it, but, when it comes to the medical industry and the barbershops and the hair salons, they have a lot in common. One is we have to trust you to go to you.
They pull that razor out.
I mean, we literally have to trust. If you go to a doctor and the doctor says to do something, and you have to trust that doctor knows what they're talking about and they have your best interests at heart, right? You have to trust that, right? When you go to the barbershop and you sit in that chair, or to the hair salon and you sit in that chair, you have your life. Not quite the life, but some people see that as that
Don't
important, because my whole image,
that's right,
is in your hands.
There you go.
You got the power. And that's so this issue of trust is so very important, and we need to talk about one is, if trust has been broken, how do you restore it? How do you rebuild trust?
Yes,
if that's the case, right? And then secondly, it's important to note, how do you maintain trust? Because a lot of times people can trust you just now, but don't trust you later.
That's right.
And so you have to learn how to maintain trust so we can maintain movements. You can't maintain a movement unless you maintain trust. And so it's important for us to do that. So talk a little bit about, being a physician and people coming into you. How do you nurture intuitively or consciously, or how do you nurture trust so that they can feel comfortable in your space?
Personally, I stop talking and just listen.
Wow.
And that is like the privilege of time that I don't necessarily have, but you can tell the patients that need more listening and time than others by the minute you walk in the door of the room, because you can just see by the body language. And a lot of them, don't look you in the eye, or, when you ask a question, it's just like one word, hesitant. And sometimes, they'll open up after a while, but most of the time they just want you to listen because they haven't been listened to up to this point.
Right.
The healthcare system is a checkbox system now. It's almost like fast food, for the doctors.
Right.
It's not,
Right.
but
Right.
they go in, they ask the questions, check, and then they can send it off to the insurance company, and then they can get their appointment done quickly and get them out. So the patient doesn't have any part of that, really. And when you have been in that system over and over, and you lose trust. So I do try to just sit and listen. Sometimes it works and sometimes it doesn't.
You made the salient point. Somebody say you spell love Time.
Right, right.
That's
good. That's good.
Because you have to spend time with people, and that shows that you care about them. My physician, I have to give it to him. He I don't know how he sees any other patients or see but 2 or 3 the whole day, because he literally comes in and he spends time with you and he listens to you, like you're saying, Dr. Ritter. He doesn't start by saying what ails you or what you're doing or whatever. He starts by talking to you about how you feeling, how's the family. He'll go through, if your family, anything happened, how are you dealing with that and all of that. He deals with that first. He humanized the experience for me. And then we get into, normally going to my annual checkups and that kind of thing. But then he goes into that. But he doesn't start with that. And he's not just walking in and doing a couple of things, checking a few boxes, as you're saying, just walking out. He does that, and then he leaves with a positive thing and look forward to seeing you again. Hope that, I see you at a football game or wherever, that kind of thing. It's just humanizing the experience. And I think the more we can become human to people, the more trust can be developed. And so Dr. Ritter, I can see why people would really want to come to you because of how you are. I've never met Dr. Ritter. People may not know this. I don't know if I'm saying. I've never met Dr. Ritter in person.
Right.
I've been with Dr. Ritter over 2 years, but I've never met her in person. Isn't that something? But I feel like I've known Dr. Ritter my whole life.
Silver lining.
So, and it's just a wonderful thing to connect with you like this, Dr. Ritter. But I look forward to the first time seeing you and meeting you and greeting you properly. Okay?
I do too.
Absolutely.
I heard you're a musician. That's what I want to. That's what I want to hear.
Oh, you are quit it. Good. Hey, let's bring up Dr. Sharon Cooper. She's a regular as well. And I have to say this, Dr. T. the how beautiful our guests are.
I'm telling you,
Dr. Ritter and Dr. Cooper. I mean, just golly. That's like glamour, like very glamorous, very, very nice. How are you doing, Dr. Cooper?
I am doing well. I'm doing excellent. After hearing that, all is well. I don't know how much I have to pay you after this, but thank you.
You're doing so wonderful. And we thank you for your work as well, Dr. Cooper, working with the barbers and the stylists, community health workers, and to truly get our, warriors to really buy into this notion that they can be advocates. People normally do what they do. I cut your hair and get my money and you go. No, I care about you. I want you to live. I want you to be healthy. And so all of that empathy, as that Dr. T is talking about, is a part of establishing trust. And you were part of the apparatus to get them to that space. And so I want to thank you publicly for that.
Well, thank you. It would not have been possible without the work of both you and Dr. Thomas and the Wellness Warriors. So it has just made it very seamless. So thank you.
Yeah.
You know, Mayor, I want to give Dr. Cooper more airtime because she's so humble.
She is, isn't
because
she?
The work that she's done is the boring stuff. All the form. Do you know the hurdle that the state put up before all of our barbers to become community health workers? It's a mountain. It's a mountain to intimidate them.
Mm-hmm.
Dr. Cooper helped manage that, and we've been hugely, hugely successful. So,
yeah,
I salute you, my sister.
Dr. Cooper is incredible. And so, Dr. Cooper, we're talking about trust. In any relationship, and it doesn't matter what the relationship is, trust is at the cornerstone of any successful relationship. What is the intersectionality of trust and the public health space? How is that playing out?
Well, you look at the historical perspective,
okay.
And now you look at innovation, such as the barbershops and the salons, and we talk about bridging that gap. Well, they serve as that conduit. They open up that door for cultivating relationships, building that dialogue, and communicating that information back to the needed providers, such as Dr. Ritter, as she's mentioned earlier. Now it's gotten to the point when, folks are going into medical education, whether it's, medical school or whether it's, school training for nursing. The aspect of the culture and understanding the community health becomes paramount in order to meet the needs successfully on an ongoing basis. And then understanding the culture and the subcultures that exist within each community. And like Dr. Ritter said, and like you, Mayor, it's an ongoing conversation. It's not one and done.
Yeah.
So I think it's pivotal.
Yeah. I have really come to appreciate, respect, and love public health. I really
have to.
I really have, because being the mayor of a city, you have people who do that, and that's just a department for me. I deal with everything, right? But I really have appreciated it with this being in your presence and really understanding. I was, law enforcement. I didn't really even think about, seat belts being a public health initiative, right? I never really thought about that. Emissions in cars and how people operate in those spaces and safe spaces and that kind of thing. All of that is driven by public health. And
Mayor,
yeah,
as I'm hearing you talk, I'm realizing the work we have to do, because when public health works, people take it for granted until that day comes and you turn your tap on and you can't drink it. So there's a new
Say that again,
imagination,
because that's important. When public health works, you don't even know it's there.
There you go. They take it for granted. Whereas the medical system, when it works, is when you come in with a catastrophic condition, they save your life.
What word that is? It's humble. Public health is humble. And maybe that's the word that, that is why people don't recognize it, because it's not boastful and prideful and like, I'm going to save your life. It's like, you can't get into a community and do community work if you're going to be that way. They're going to reject you. They're going to like, oh, who is this person telling me what to do, right? So the humbleness of public health is what I'm recognizing is pivotal in trust. But it's a self-fulfilling prophecy. Then when you're humble, you don't, you don't take credit.
And in a very competitive environment where the pie, if you get something, I don't get something, we need the clinical community to support public health and vice versa. So now think about it, Mayor, because your insight, you're not alone. Many of our students are saying, my parents finally know what public health is. It took the pandemic. and now the water crisis, and now
Right.
climate. It's all coming to the forefront that has been in the background. So this is our time right now.
Right. We need to do a show on what is public health and do
I like
nothing
that.
but delineate the different ways that public health impact our lives, and just do a whole show on it. Right.
Mayor.
I mean, and you know, we're going to kind of do that with Meg with the Public Health Minute.
That's right.
Today. But we need to do that, because if people don't know, they don't know.
Think about it, Mayor.
Right.
Front pages of our paper have polio returning to the United States.
Right.
We should, again, the warriors are on the front line. We're keeping that conversation going. We're going to keep hammering on the door to bring the clinical partners out to do those boosters and the flu shot. But I'm seeing a sea change on the ground. I'm seeing, just like our word clouds have both the challenge and the opportunity, there's a lot more feeling of opportunity. I think we're going to hear some of that tonight when we hear about the events coming up in the Warrior Network.
Right. Well, we're going to talk about that. Let's bring up Meg Jordan. Meg is she's multitasking today. So, you know, but she's got the power. We got Meg Jordan, who is our technical director, but she's also dubs as our Public Health Minute person as well. Meg Jordan with the Public Health Minute.
Okay. Good evening, everybody. Let's talk about the COVID numbers. Okay. So right now, we have cumulatively 94.7 million cases of COVID since 2020 in America. We've had 1,043,000 people die of COVID-19. 224 million Americans have been fully vaccinated, meaning that they've gotten 2 shots of a Pfizer or Moderna, or they've gotten 1 shot of a Johnson & Johnson. And 108 million people have gotten their first booster dose. So in terms of the COVID community levels right now, we are doing worse than last week. 25% of the we're doing better this week. 25% of the country is at high, meaning that everyone in the community should be wearing their masks, high quality masks, everywhere that they go. 42% of the country is at medium level, meaning that people who can be considered high risk should be masking once again and considering testing. And 32% of the country is at low, meaning that if you feel comfortable, this is it's safer to take your masks off if you choose to do that. So I want to talk about public health. This is a public health minute I've wanted to do a long time because we've been talking a lot about pandemics in the past 2 years, and people talk about the 1918 pandemic. And the way that people talk about pandemics is that we've never done this before in living memory. You know, this is abnormal. And while those things can be true, disease is actually such a common human experience. So I wanted to talk about what public health is for. So I used the World Health Organization's 3 aims for public health. What do we do? Prevent disease, promote health, and prolong the life of the globe.
Of the globe?
Of the globe.
That's everybody, Dr. T, everybody.
So I wanted to open up this question that I've heard a lot. How do pandemics end? One of the things I've been getting into for the past 2 years is pandemic history, because there have been pandemics for as far back as we have history, and each of them can be managed a different way. So when we think about, these are some of the major diseases that have killed people for 1,000 years. Dysentery, schistosomiasis, sleeping sickness, malaria, dengue, scarlet fever, tuberculosis, typhoid, cholera. In America, we don't hear these as much anymore, but these are still global problems, some of these. How have we managed these? Sanitation, clean air, clean water, learning to wash your hands, learning to keep your bedding and your bugs away from your bedding. These are the ways that we manage disease. We did this in COVID, hand washing immediately, wash your hands for 30 seconds, hand sanitizer everywhere you go, wiping down your groceries. That's why we, at the very beginning of the pandemic, had a grocery washing rage, right? Because if this was the type of pandemic like those that spread that way, this would have been important. Rickets, pellagra, scurvy, ergotism, the dancing plague, and goiters, which are like swellings underneath your neck. All of these things used to be epidemics that would pop up every few decades across the globe.
The dancing plague, man.
The dancing plague, yeah. It's a fungus.
I have that every time I go to the disco.
Okay.
That's why they're giving them Greek numbers and letters.
That's what I'm saying. Tell me what I never heard of the dancing plague before. So I never heard of it.
Yeah. So the dancing plague was it's part of what we call ergotism. Sometimes when fungus grows on grains, so it can happen, it's typically on wheat, you get a fungus that starts producing chemicals in your body that make you hallucinate and make you move involuntarily. And so there was, I could get my textbook, but there was a particular outbreak of this that was really famous, St. Vitus's dance, where people danced in the street for days until they literally died. This was not necessarily something this isn't voluntary, you know what I mean? There's like, it was blamed on possession, and it was blamed on, mental illness, but really it was just this fungus that can happen on wheat. Yeah.
Again, misinformation.
Right. We always learn something every time. I learn something every time. Thanks, Meg, for doing that. I knew a lot of people probably didn't know that. That's why I brought it up to make sure that people could understand what
that we remember. And the misdiagnosis back at that time that gave it that name, those people were ostracized. Now science helps us understand what it is.
Right.
Now you got the real one up, Meg. Diet. What?
Diet. So what I mean by that is that a lot of these diseases are vitamin deficiencies. The reason people used to have goiters is iodine. That's why we iodize salt.
Public health working.
Yeah. So that everyone eats salt, everyone eats iodine. We don't really see goiter except in places that are having like famine, right? Rickets, pellagra, these are all vitamin deficiencies or sun deficiencies. And you kind of saw this during COVID pandemic as well, because there were people saying, make sure that you're taking the right vitamins and supplements, make sure you're out in the sun and getting your vitamin D. And these things can be immune boosters, but none of that is really going to touch the root of why COVID hurts your body, right? The way that rickets is a vitamin deficiency. Same thing. So typhus, syphilis, venereal disease, plague, the Black Death, very famously, these are all bacterial diseases. These don't have to be a problem anymore because we have antibiotics.
Yes.
And because we are developing new antibiotics all the time.
Mm-hmm.
We didn't see this as much in COVID, so I had no COVID parallel, because we knew very quickly that it was a virus. So smallpox and mumps and measles and whooping cough and diphtheria and rubella and meningitis and polio were all major killers of adults and children throughout history. But we don't see outbreaks of these as much anymore. Vaccines. Because all of these diseases responded really well to vaccination. Smallpox particularly well because it's eradicated, right? Polio could be eradicated soon because of vaccinations. Some diseases you can get rid of that way. We're trying to get rid of COVID that way. It's one of the tools in our kit. So I brought all this up to say, how does a pandemic end? Lots of different ways. It ends by good sanitation. It ends by vaccination. It ends by doing all the things in public health that keep you healthier. But that's when public health was recommending all these things, and when people were doing all these things to keep themselves healthy at the beginning of the pandemic, these weren't crazy ideas. These weren't out of nowhere. These were people who recognized patterns of things that worked in previous diseases and really wanted to offer something based on history that worked. It's just that not everything works against all diseases.
So we're still in that natural experiment, and you can see how important trust is, and you can also see how when public health is successful, how we forget. Rather than having people change their behavior to take an iodine pill, we put it in the food source, and now you don't even think about it. And as a result, we can water. We have put chemicals in the water to help our teeth. Fluorine, yeah. And there were big fights about fluorinated water as well. As we move to bottled water, guess what? There's no fluoride there. So we forget how we've made the success that we have so far. We should be alarmed to see polio back in the country in the front pages.
Yeah.
And we need to look in the mirror, because clearly the current system is not working in devastating ways. But as Meg pointed out, during the pandemic, we hit on some things that can work. And let's make sure moving forward, we keep doing those things. Resources are not mere. The community needs that kind of consistency for the trustworthiness.
Right. You know, and we also know that managing expectations is a part of really engendering that trust, you know, telling people that at the 4th of July, everything gonna be okay. You know,
avoid that.
I mean, we gotta avoid, you know, making blanket statements like that. And then when people have to continue to go past that, then now people are wondering, do you really know what you're talking about? So that's good. Meg Jordan.
Thank you.
Claps for Meg. Thank you so very much, Meg.
Hey, Meg, you know what? I have to say, the fact that she's excited about public health history, I think is really important, because it's those lessons we need to move forward. We've been here before. We can get out of this even better.
Well, I'm excited about public health as well. So this is good. You gave me a great history lesson, Meg. Thanks so much. We appreciate that. Get ready, because I'm going to be doing a pulse in a minute, and we're going to try to figure out what's happening with how we feel. I was told it's Dr. Cook with us. She's still with us.
She may not have joined yet.
Okay, she didn't join.
But we have warriors out there.
Okay, all right. Let me go and bring up Andre. Now this is the earliest that I have brought Andre up, and I know he's going to be so excited about this. Hey, Andre, how are you doing, my friend?
I'm doing well. Thank you very much, sir. And yourself?
Absolutely wonderful, man. Let me tell you something. We were talking about it earlier because we're talking about trust, but if you have to trust your barber, right?
Of course.
And there are people who will not see but one barber. I mean, there are people who will come in one of your shops, and they'll ask for their barber, and if their barber is busy or is not available, they'll leave and come back when he's available. Is that true?
That's very true. We have customers that come, and we've been in business for just under 20 years, and the same barber, and now their kids want the same barber, and it just goes on and on, because that's when you're talking about trust. They figure they're going to get exactly what they want when they come, and that's the way it works.
Right. And go ahead.
No, go ahead.
No. What you're absolutely right, because people want that consistency. They know that this person know them. They know how they like it, right? And if they're going to modify any, they'll talk it through, right? Just a little bit off the top. I can't say that any longer, but
You're going to the wrong barber.
No. If I get it more cut off my head, it'd be prepping for brain surgery.
Mr. Mayor and Andre.
Yeah.
When you're in the shop, you also have a chance to just simply observe, and it's always fun. So I'm in the shop, and someone comes in with a very interesting hairstyle. This was a woman. She's in the barber shop one side of her, the left side is shaved, like natural, and the right side is like long, just like Dr. Cooper. And do you know she had a barber for each side? She was at Fred's, and only Fred could do the shave side, natural side. She went to somebody else for
the other side.
That's the relationship
Right.
that people have. I trust Fred on this side. I trust somebody else on this side. And she voted with her feet.
Right.
So if we can turn that kind of a space into a place where people can learn to save their own lives, I think we've done something important.
Yeah, because I think that goes a long way. And I think Ms. Jenkins, her being also a stylist, can go with what the mayor is talking about, because she does people like that all the time. And I saw her there for a second, but she went away.
She's gonna be back.
Oh,
Yeah. You know, and the other thing is, we talked about trusted information centers. Well, the barbershops and the hair salons are trusted information centers. That's why we are talking about, well, how do we not only deal with COVID, but deal with other issues in that same space? Because if that's where people are trusting, then let's go there. And provide whatever services we can provide in conjunction with trusted spaces. And that's why the barbershop is one of those spaces. And we appreciate you, Andre, for reaching out to Emory, and Emory reaching out to you to look at other ways to deal with, you know, diabetes and hypertension and other things, all of the other stuff. Yeah,
because it's one of those things where it's a combined effort with everything that everyone is doing. And what we're doing with our wellness warriors, and I don't know if you guys appreciate this or not, but I do. We are now giving our wellness warriors more information. So when we sit down and talk to our customers, and when our barbers talk to our customers, we have a definition behind our conversation. Mm-hmm. And I think that's a wonderful thing. I do not think that's a bad thing. I think that's a great thing. This wellness warriors, and now they can get certificates from some of the other places. Not in Atlanta yet, but
we'll get there.
Right.
But I think that's a wonderful thing, because now when people talk to their customers, they're talking about some positive things. And we ran across some things where if a customer says something in particular, we can put forth a cognitive effort to say, this is a problem, let me address it. And they can bring up a different conversation with the customer, and perhaps suggest, I'm going beyond what we're saying, but I say, do you think you need to see a therapist or something? You understand what I'm saying? Yeah.
Right.
So, well, so we're getting to that point now. Yeah.
You know, let me say this in addition to that, Andre, because I agree with you, every word you said there. Mm-hmm. The point of the matter is, you all know these people.
Yes.
You know when something is different.
Mm-hmm.
When they come with a different, if you see depression, you can kind of, you may not know exactly what it is, but you know it's something different about that person, because you've been there. I mean, you know when your family members, you know if they vibing and not vibing right.
Right.
And a lot of times we can, talk or listen to people, and they can talk things out, and they leave there feeling better than when they came. That's what it's all about, because that trust, continuity, and a repeat customer. So we love all those things. Absolutely.
Dr. Ritter said a couple of things earlier, but I'm going to go ahead and let you guys get back, because
you part of the show. This is, we wanted to have a kind of open conversation, just really talking about this, because this thing is trust is very important,
right?
And it has a rippling effect to many areas. Let's Sandra Jenkins has been one of our team. She's an integral part of the Cutting Edge, and have been for a long time, and she focus on the areas of trust all the time. We talk about the fact that they come to her, she listens to them. And you notice that Dr. Ritter mentioned this. She said, I said, well, how do you get people to trust you, Dr. Ritter? And Dr. Ritter said, I listen. Not what I say, is that I listen. And empathy is at the cornerstone of trust.
Absolutely.
And you can only empathize when you can hear what people are saying and what they're thinking and feeling. Sandra Jenkins, how are you doing this evening?
Down there in Philly.
All right. Doing well.
Good.
Yes.
What do you think about this conversation? Because this is well, obviously it transcends all people activity trust, right? Right. Every interaction with any human being, there is an element of trust that has to be at the cornerstone. And being in the hair industry for many, many years, you know this better than most.
Well, thank you. Yeah, and there's so many different angles that I could talk about trust. However, in relation to whatever just hit my mind just at this time, it took me back when I was growing up as a little girl. My mother she was just always constantly instilling in us, you better tell the truth. You better be truthful. I don't like it when people exhibit jealousy. I don't like those types of things. Be honest, be truthful. And I was that child out of the 6 of us that was attached to my mother like Velcro. And my mother was very nurturing. Her hands were gifted. And I will just share a snippet of why I say that is because when I was 2 years old, I was severely burned from the top of my head all the way down my face and my shoulders. And it was terrifying. And my mother was that nurturing mother that quit her job to take care of her baby. And that nurturing, I just really felt like, even though I was disfigured, I felt like, I was beautiful. My mother always instilled in me that, Sandra, you're beautiful. She dressed me up like Ruby Bridges. That's what I looked like when I was growing up, with the books in my hands and pencils. And I just thought I was great. My sisters were afraid of me, but I didn't care because Mom was telling me that I was beautiful. And she just really used her own common sense and used the proper salves on my face and on my body to clear me up. Nobody would know this. Nobody would ever know this, that happened to my life. And from there, that's when I really felt that it was so important to exhibit that same type of love, care, and trust to people.
Wow.
And that is really goes deep down inside a core with me. And as to why I say that trust and the truth are the 2 pillars of building relationships.
Wow.
That and
the fact that some of our grandparents and stuff knew all the secrets that the doctors know now.
Oh man, they would go in the woods and get some stuff, whatever it was.
Mayor,
take a little bit of it and you next day it'll clean you out, but you'll be all right.
Yeah.
Mayor,
I'm looking at her now and I see nothing about burns. And now they have trauma units at Grady.
Well, Andre, you said something, the mayor said something, and I want to come back to Sandra, who's been on this show many times, but that's the first time we've heard that story. So I want us to acknowledge the sacred space we've created here where Sandra has opened the door for that kind of humility. And it's such an important story because for your mom to change her, whatever career trajectory, whatever she would, to love you the way she did, to mother you the way she did. We heard about mothering.
Right.
That's what people need to know when they're sitting across from someone who has the power to change their lives, that you will not be hurt, you will not be harmed. But look, Andre, you're absolutely, I'm looking at her now. You never, ever know. And yet she is,
and Sandra Jenkins
on
is
charge
beautiful.
of that, the whole issue.
And we know that, and she knows it too, and everyone knows it. And so we are so appreciative.
She keeps that camera up close, and I said, "Oh,
I can do that, Andre." That's let's bring Dr. Tuesday Cook up. Keep everybody with us. Hey, Dr. Tuesday Cook, how are you doing?
I am doing great. I'm actually glad I made it in time to hear that story. That was a wonderful story.
Yeah, we miss you so much, Dr.
I miss you all too, family.
Absolutely.
I miss you all too. It's been
Look
a
at her.
crazy time.
You see those glasses? That's swag.
That's where I was going. That's where I was going.
You talk about that swag. She knew you ain't have to do that, Dr. Cook. Now you know that you know you're wrong for that. You're gonna come in here just drop the mic on us with our glasses. You know.
When you get old, you gotta spice it up a little bit.
Well, you sure did. I love it. I love it.
You go,
really,
girl.
really nice. I love it.
How have you all been? I'm so glad to see you all.
We better now.
Yeah.
As am I.
Right.
That's
wonderful. We're talking about trust today, and how important it is.
Mm-hmm.
And we're talking about it in the context of, empathy and love and truth, right? Because all of those things are critical. Sandra talked about it. She said, if you don't have, trust and truth, if people can't trust you, if you don't tell the truth, then you cannot, people won't trust you if you're not telling them the truth, right? And that's so critically important, and it's so fundamental, but I think people miss it. What's your thought?
I have to agree with that. It's funny. It's very
Hold up,
interesting.
can we do something, because you hadn't been on for a minute? Could you tell people who Dr. Tuesday Cook is?
Yeah.
Oh,
because we know who you are, but there may be two people who may not know. So for those two people,
it's the family that's here. It's the family. We know.
I know that, so, but tell people who
for the streaming audience.
For the streaming audience.
Absolutely. So I'm Dr. Tuesday Cook. I am a fellowship trained minimally invasive foregut and bariatric surgeon. I'm director of the MIS foregut and bariatric surgery program at Adventist Healthcare Fort Washington, right there in Southern Maryland, where we are 83% minority, and where we need the care that everyone else in Maryland and the US gets. I am an advocate for health equity and decreasing health disparities. And I guess I'm president of the Montgomery County Medical Society, and I'm an executive board member of Women Leadership in Surgery, and serve on a bunch of national, international committees. But most importantly, I am a big advocate for my patients, and my patients are patients who suffer from obesity and the medical problems that go along with it, like type 2 diabetes, high blood pressure, high cholesterol, et cetera. So constantly working with legislation, et cetera, to improve the lives of patients with obesity and improve the lives of people of color.
Don't hold anything back. Just tell us everything.
If she told us everything, man, we wouldn't have time left.
Well, what's so nice about it, Mayor, is that Dr. Tuesday Cook was here at the beginning of our journey.
Absolutely.
And while people come in and out of the flow, she could just step right back in, and she felt the energy. You came in at the right time, as Sandra told that powerful story.
Powerful story.
But Dr. Cook, our healthcare system is in trouble. And this issue of trust is at the forefront of it. And while both you and Dr. Ritter are in these systems, you clearly have found ways to work around the edges to bring equity to the populations that we're talking about. Are there some of these silver linings coming out of the pandemic for you that has changed the way you're going to do your practice, or even what you're seeing when people come to you?
So I'd say there are a few. One I would say is the increase in televisits, which might sound crazy,
Okay.
but actually is good for certain patients. Now, some people don't have access to a smartphone, et cetera.
Okay.
But a lot of people now do, even with plans that they just pay as you go along. And with doing that, with seeing a lot of my patients in televisits, I have been able to see new patients who are far
Okay.
away from me.
Right.
You know, in rural areas.
Right.
Maryland has rural areas.
That's
people may
right.
not remember that. They might think you have to go to Tennessee or Alabama, right? To
Right.
ski, think it's
Right.
rural, but
Yeah.
Maryland has some rural areas.
The Eastern
Right.
Shore.
And
Yes.
we
Let me
call
tell
that
you,
we call
deep
that up
down
south.
on the plate of-
We are below the Mason-Dixon
We're
line.
below the Mason-Dixon line. So, you know, and some of those people who want to seek weight loss surgery, they want to seek care for their heartburn, and they want a doctor who looks like them, or things like them, they, you know, have access to that. They don't have to get metro access to drop them off and pick them up. They don't have to travel for an hour and a half to see me like some patients used to. They can, you know, go to a library and use a library. They can use their phones to see me in a visit, and then we can just you know, make arrangements for them to come to the operating room when they need to come. So that's why, so increasing access to care using televisits really helps me to reach people far and wide through a lot of parts of Maryland, and honestly some other states where people have moved but still were my patients, so they can follow up. That's one. And continuity of care. I'd say the second thing is people knowing that they can look for a person of color to take care of them.
Okay.
So some people, I think before we really tried to highlight that you can have concordance in care, people just kind of thought they just had to go to whoever was there. But now they actually know, you know, if I want a doctor who I can relate to a little bit, I actually can look for that person. And I've actually had patients who found me by Googling, like, oh, you know, I had a lady today who was Mexican, and she was like, yeah, I looked you up. And I was like, oh, well, wow, I'm not Mexican. But she was like, yeah, I like women and I like people of color. And so I'm coming to you for my weight loss surgery. Now the lady lives, I want to say she lives in like Silver Spring, maybe. And I was like, you gonna come down to Fort Washington? She was like, yes, I am. I sure am. And so, you know, she was like, you know, I'm trying to make all my doctors a person of color because I just relate to that better. And I was like, that works for me. And quite a few patients are now looking and finding what it is they wanted, but didn't think that they had the ability to do. And I think that that trust comes in because, you know, I try to keep it real with my patients, to be honest. And sometimes, you know, we have to do this, or we have to do that. I give them all the options, right? I provide them with little links to explanations in our chat, or I'll go through it with them. I'll share my screen so that we can talk very honestly about what their options are. And it makes it so that they can trust you because they know that you're coming from a place of, I want you to know this is what we can do. These are what the outcomes may be, you know, and having a good conversation like that, I think it's helpful. But trust is very important. You know, somebody trusts me to cut them open.
Wow.
Somebody trusts me to reroute their bowel or to pull their stomach out of their chest. You got to have a lot of trust if you're going to go to sleep and let somebody cut you with a knife.
Right.
You know, Mayor,
all of that's right there, Dr. T. Go ahead, Dr. T. Go ahead.
I was just, as I'm listening, recognizing that again, during the pandemic, they opened up and brought down the barriers to telehealth visits. They addressed issues around parity in terms of how payments were done. They got rid of the disincentive. And so now we've heard an example of how it's actually improved access. That means improving and advancing equity. So those of us who are not physicians,
and make sure, I want to make one quick point.
Yeah.
Think about it. If people who had children had to find childcare to be able to come to their doctor.
Right? That's right.
People who had no time or PTO had to find a way to get some time off and would miss their doctor's appointment if they didn't have any time off. And that impacts their healthcare. They're less likely to seek healthcare.
And it labels them as, you know,
non-compliant.
So here's where we need to help them, warriors. There's legislation that helps to open up the doors for telemedicine in your state or even nationally. We need to pay attention to that legislation. We need to know, we need to support that legislation. And that's how we can help the physicians. That's a wonderful story, Dr. Ritter. I've seen it even with our community partners.
Right.
That's one of the silver linings of this pandemic. People be getting more comfortable getting information from these Hollywood squares.
Yeah.
Hey man, we got to find out what's going on out there.
Yeah, let's do a pulse of the people who are connected to us today. What we do is we have a word cloud, and we asked you to put in a word that best describe how you're feeling now, right now, or words. You can put in as many words.
Many words. You want 60 seconds? Just let them run one at a time, as many words as possible. They'll build that cloud. And those of you out there in the streaming land, you can use your Q&A box, and we'll build the cloud. And Mayor, you know what's coming up is some of our warriors have events coming over this weekend. And I'm really interested in the creativity. And let me give you one other example. I get a text from Miss Dorothy Reynolds from Pine Bluffs, Arkansas, just letting me know with a long message. I won't be on today. I'm on vacation, but I just want you to know. And it's just so sweet, recognizing here again, that's that trustworthiness. I'll miss you guys. She didn't have to do that.
Right.
There's a connection here. There's an energy here that is helping them keep up the fight in the midst of diminishing resources and diminishing air cover. You know, without the air cover to promote boosters, it's hard to do that one-on-one in the shops. We need that air cover.
Yeah. You know, I don't know if Katrina Randolph can do audio or video, but let's go to Stacy Ruffin. And I know I got,
and Antonio's out there too.
Antonio is out there.
Antonio
okay,
Spicer's out there.
Okay, so if everybody can just put on your cameras, that way I'll know that you are ready to rock and roll. Hey, Stacy, how are you doing?
I am blessed. How's everyone?
Absolutely blessed by the best, right?
You know it, yes.
Absolutely.
Hey.
Yeah. So
Stacy, can you get some light on you?
Yeah. Get some light while we go to Katrina. We're gonna
okay.
Get some light. You work on that, and then we're gonna go to Katrina. Hey, Katrina, how are you doing?
Hey, Jane.
Unmute.
I'm fine. Hello, everyone.
Hey, what's going on? How you doing?
Can you hear me?
Yeah. Look like you got.
Glad to be on this call tonight.
Yeah, look like you went and got your hair did too. Hey, Dr. Cook, you know that's how we say it, right? All right, so you know this thing called trust. That's what we're talking about today, Katrina. And we do know that you all have an event coming Saturday, but we're going to talk about that, and I want you to kind of highlight what that's about. But this thing on trust, I think is sometimes we think it's understood, and so we don't talk about it, but we need to talk about it. And we need to talk about what is it that erodes trust, and then what is it that strengthens trust, and then what is it that sustains trust. And if we talk it out, maybe we can inculcate those things in our daily activities as we deal with people, right?
Right.
You know, so when it comes to, I assume that you've had clients that are customers or clients that have been with you for years, right? And they don't want anybody to touch their but you.
Yes.
Huh?
She's got a bit of a delay.
I think when they come into cliches, they trust all of us to do their hair. So I think building trust and relationships is all about community, spending quality time with one another, coming into the salon, engaging one another, just sharing information. I see a lot of the clients that has been with us for a very long time. Some of the conversations they share, I'm amazed at. I'd be like, you sharing that with us? And they will share with the whole staff. So I think it's all about the time being spent, the time that they've been in the salon, building trust and relationships with us. So definitely, I think that sustains their relationship. Just spending that quality time with this.
So it's talking to each other, communication and talking and being real. Does that engender trust as you see it? We want to
Go to Stacy.
I
She comes back.
I think you're back now. Okay.
I'm back.
Now talking and having, it's about relationship, isn't it? Katrina?
Absolutely, yes. That long-lasting relationship coming to the salon, because when I think about it, I think about how often they frequent the salon. Most of our clients come in once a week. So just having that personal relationship with us, and like I said, sharing that personal information builds those trusting relationships.
You all spend more time with your customers than doctors spend with their patients.
For sure.
Yes, we do.
Right.
But you know what else, Omar? Mr. Mayor, I have we've done a lot of this Zoom work, and so sometimes in the early days, Katrina would be on the show working, and somebody's actually in the chair listening to the whole conversation, just sitting there listening. Do you know, I've seen, well, Katrina, have you had some in-chair conversions? People who went from hesitant to I'm now accepting simply by listening to the conversation?
Absolutely. Definitely during COVID, or just having health conversations and some of the health issues that some of our clients have. Yes, they were able to, make better decisions for their health as far as their diet is concerned. And they're excited when we're on these calls. They like, wow, I didn't know that, or I'm going to talk to my doctor about that. So definitely being on these calls and having the clients being able to listen, they're always excited and learning something new.
Yeah. Now you all got some stuff coming up this coming Saturday. Tell us a little bit about it.
So yes, we're doing a health symposium at the Shop Spa on Saturday. So I'll be there with the table, engaging the community in regards to encouraging them to be boosted and why it's important to be boosted. We're also going to be doing high blood pressure screenings. We're also going to have music, DJ, food. We're going to have a lot of fun there this weekend. I'm excited.
We know how.
Yes.
That's why people come. If Meg's out there, put up that flyer. And it's the kind of creativity that's happening all over the country with our wellness warriors. I mean, you see that, you say, "Hey, I want to go there."
That looks like fun. You just look at the flyer; it looks fun, like fun.
And you can get $25.
There you go.
Yeah. Oh wow.
Yeah.
Right.
$25 for checking your blood pressure.
Yes.
Yeah.
So I hope to have a line, and unfortunately,
you have a line around the state.
So a lot of eyes are on this new model. If the challenge has been when our clinical partners have arrived at some of these community settings, if the people aren't there or the people are resistant, they feel like they've wasted their time. Well, we now have relationship. When the people show up, they're there. Mm-hmm. And we want the clinical partners to recognize that every arm counts. We're not going to have those big, massive vaccination clinics like we've seen in the past. So 30 here, 40 there, 25. Every arm counts. I want you warriors to know that matters. One case of COVID in a hospital is hundreds of thousands of dollars. And we don't know what long COVID will do. So we're really making a difference. We're not going to be able to boost our way out of this. We're going to have to actually prevent the spread. And that's why it's very important that you guys have your care packages to give out masks, to give people rapid tests, to encourage them to do the mitigation. And Mr. Mayor, I'm seeing that happen when I go to the shops. Folks do have their masks. They have the signs up, and it doesn't feel oppressive. It feels like the right thing to do.
Well, we all in this together, and Meg put it perfectly when she said, if you do these things, then we can deal with these viruses and these pandemics and these epidemics or whatever they are. We can deal with them if we all are in this together and we're willing to do what's necessary. So I think, and that's where trust is, that we trust each other to take care of each other, right? That's so important.
Stacy got some good light now.
Yeah, Stacy got, Stacy got a swag going on anyway. I don't know, y'all found these glasses, with the hat and the glasses and all of that.
It's a Sixers hat.
It's the Sixers hat. How y'all gonna do this year?
Oh, well, I don't know, but I know I'm getting my season tickets tomorrow. So
how you doing, Stacy? This trust thing, I think if we can get to trust, then we can deal with many of the ills, not only in the healthcare space, but in all spaces, because trust is so important. What's your take on trust?
My take is, which is wonderful, and I can say you guys helped me make my decision of what I'm trying to do. I don't know if you guys know, I opened a wellness center. It's called Sonny's Wellness Center at Rejuvenate.
All right.
Wonderful.
Come on.
I didn't know that. Let's give us some snaps. I
together.
didn't know that. I mean, wonderful.
Entrepreneurs.
Yeah. Absolutely.
Opened it up in Jamaica August the 13th, and then in America September 1st.
What?
Opened it up in Jamaica because I found a place that has like everything that we need to sit down and talk about, not just COVID, and we need to talk about sharing what things people are going through now. So I it up. So Monday starts my first senior power class at 11 a.m. I teach balance and I teach control. I am a vegan now, you guys. 100.
Wow.
Oh, girl.
That's wonderful.
You know that you feel the difference?
I feel amazing. I feel like I'm 20 again. I'm being
well, you're 21. I mean, so it's 1 year difference.
You gotta be legal.
Yeah, in Jamaica for sure. Yeah.
So the trust is I took 20 seniors to Jamaica with me.
Oh,
and they
wow.
Aqua class. So it was 20 people over 65 years old that went to Jamaica. One day I could show y'all the pictures. They are my foundation of my wellness center. My wellness center is called Sonny's because my dad was 97 riding the bike. And I took him off of a lot of medications and just start, treating, feeding him right, taking them off so he wouldn't swallow pills. So it's just things that I have people coming in to talk about wellness and, of course, the COVID, shot and everything. So, but I'm praying that I can retire January 1st from here and go 100% into my Sonny's Wellness Center.
All right.
Helping the seniors.
Right.
And that's what I dedicate my life to right now, is just getting people to trust me and try not eating meat for 2 days.
Right.
So, these are things, that we have to get. I have all of my clients, most of them, I shouldn't say all, most of them trying it. And and everybody that went with me, they tried Meatless Mondays.
Okay.
Right. Well, if you do it like, just say 1 day a week, just
try
do
it
that.
out.
Yeah, just try it out. See what it's like. Yeah, I agree.
Yeah. So that's what I'm doing. I'm just trying, like I heard the doctor talk about obesity, and I try to tell people, even now I went back in service at church, and I try to tell people obesity is not right. They're thinking it is, but it's hurting us. So I'm going to do all I can to try to help everybody, our people, especially with this obesity. And that's what I've been doing. So I missed you guys.
We're so proud of you, Stacy. Thank you so much. Thank you for what let's give Stacey.
Come on now. I love that entrepreneurial spirit.
That's wonderful.
Always,
thank you, Stacy.
always.
The wellness industry is a multi-million, maybe billion-dollar industry. We need more of us involved in that, and coming out of the shops is a natural way of doing it. Absolutely. Let's go to Antonio out there.
I see he's out there. Let's bring him up. Antonio Spicer. Hey man, how you doing, man?
I'm well. How about yourself?
Everything's wonderful. We having this conversation on first tell people who you are, and then
and where you are, brother.
And where you are, and that's fine.
Antonio Spicer. I'm in Cincinnati, Ohio. I've been a barber for 21 years.
All right. You sound like a radio host, brother.
Yeah, I told him before. He's got that voice, right? But trust. Let's talk about trust, man. How important is trust from your perspective, Antonio?
In my profession, is very, I'll say it's needed. because one, the individuals that you're dealing with, as Andre spoke earlier, if you've been doing this for a long time, I'm cutting generations. I'm cutting from great grandparents to grandparents to the parents to the grandchildren.
Wow.
Those children have children. And that's trust within a family and a family tree. But if you don't formulate certain things in a correct way, you can't gain that trust.
Right. So I want to pivot to talking about restoring trust if trust is broken. Is that possible, Antonio? I mean, and I know that's a question I didn't ask to everybody else, but I figure you can handle it. Go ahead.
Oh, you feel like I like that.
Yeah.
To restore trust, you have to be able to trust the person.
Right.
I like to tell people all the time, can I trust your word? Do I have to question your word when I'm not around?
So your word is your bond,
When
right?
I'm not around, I can't trust you. Say that again, I'm sorry.
Your word is your bond. You remember we used to say that when we were growing up?
Correct.
People did contracts with a handshake.
Correct.
Correct.
Right. So go ahead. Go ahead, Dr.
What I'm hearing Andre say is that he still wants and has the handshake of trust, that it doesn't have to be a contract. Am I right, Andre?
No, that's absolutely correct, because
I said Andre, and
but you meant Antonio.
But both of you, because
both
of the
of y'all
years
doing
of
the same thing.
experience.
Yeah, absolutely. Go bring him up. Yeah, it's
so-
important. And you know, there's some things that we know are old fashioned, right?
Right.
I believe that a person's word is his bond. And I just believe that. I'm gonna let both of y'all say something about it.
Right.
Antonio,
So Antonio, you start first.
Right.
Relationship versus transaction.
Relationship versus transaction. When a person enters a shop for a haircut, you know you have a transaction.
Yes.
But the relationship's created through the chair and through the support you have for them and that they have for you. When that relationship is created, it'll carry on further. So what I mean by further is when you're going to those college graduations, when you're going to the football game, you're going to the high school football games, when you're going to the weddings, when you're going to the children's christening. Those are all the things you're doing as a barber, but that's trust. These people are inviting you to your family. They're inviting you into their family as well as you are to theirs. So that's where the trust has begun. Once that is broken, you'll never have it again. What I call our barber industry is very fickle. And what I mean by fickle is once you mess your name up, very hard to get it back.
Correct. Right.
I've seen people who destroyed their name and they have jobs now.
Yes.
What I mean by jobs, they're not self-employed, they're not entrepreneurs, they're not barbers anymore. They actually had to go get a 9-to-5 because they destroyed their name. And within this industry, if you're not professional, you destroy your name. If
they say
you need to be there at 6 a.m. Not I'm showing up at 7, but my appointment is at 6. Not I'm giving the person the type of haircut I want them to have instead of what they've asked me for.
Hey, you know, Andre,
Yes.
Antonio, before Dr. Tuesday is going to have to jump, and maybe she drops some wisdom on both of you. But before she goes, we want to say thank you for coming.
Thank you.
Thank you so much. We like
I'm
to
glad to be here.
see you. You know, Dr. Cook, you can come on anytime you want to. In fact, anytime you just let us. You don't have to tell us. Just come on in. Right?
And get another pair of Cazals.
It's like we used to do at the Ghetto South, man. We didn't even lock our door. Folks just come in your house.
It was the same thing in Trinidad. You just pass by and you know you're going to get a meal. And if you need a bed, you could just find your space and get a sheet. And everybody
absolutely.
Well, thank you so much.
Go with this homework before bedtime. So I don't want to shirk my mom duties.
I hear you, mother.
Yeah, would just say a word as you leave us tonight.
Absolutely. So I think that just like you got to trust your doc to care for you the way they would care for their own family member, give you the right meds, listen to your problem. I had late start crying today because I actually listened to what she was saying. And the trouble she was having somewhat stemmed from her twin sister being ill, not really her being ill. So that trust is important, just like a doc trust. Same thing with the barber and hairstylist. Let me tell you, because You want to walk out that shop feeling like you look the way you want people to see you. And you would not go to a salon stylist if you don't trust that they're going to have you looking your best and feeling your best, because that really, really matters, right? So trust is key. Trust is key in every walk of life that we have. Trust is key. And so, you know, I hope that I can continue to have my patients trust me, and that I can trust my docs and trust my stylists. Trust my right.
I love you. All right, Dr.
Cook. Don't hold anything back now.
We're there, Dr. Cook. Dr. Tuesday Cook, ladies and gentlemen.
There we go.
See you next time.
All right, on the cutting edge. All right.
Now, Andre was going to riff on this.
Andre, okay, Andre, go ahead
and while that's happening, while Andre's talking, go ahead and bring up the word cloud just so we can see it. Go ahead, Andre.
Oh, I was just going to say, Antonio stole my thunder. So I'm going to talk about, hey, wait, we're motivated. We have knowledge, encouragement. We're driven. We're resilient. All these things are positive things as we go along.
Amazing.
What's the largest one up there, Andre?
Motivated. And we are totally motivated in everything that we do as a group and as individuals. This is something that is going on with us. And I'm not as old with you guys as Dynamite. However,
you've been with us for a minute now. Right? I don't know how long, but you have earned your bona fides.
Absolutely.
Right. Okay, go ahead.
My bona fides.
Yeah, that's right.
But it's not. I'm looking forward to doing a whole lot more things. I know Dr. Cooper had something else that she wanted to say, so I'm not going to be long. But I'm looking forward to doing some more things, and I'm definitely going to need Dr. T's help at the airport. Definitely. As soon as I gather these things up, I'm going to need somebody to back me up on the things that I'm promising and the things that I'm saying.
We got you.
All right. And Dr. Cooper, go right ahead.
Dr. Cooper's gone. Dr. Cooper.
There she is.
No, right there, Sharon Cooper. There she is.
Okay, no, I was just agreeing with what you said, the importance of what you said. So nothing up there.
So Omar, Mayor, can you believe it's 8:26? I want to bring that workout back up one more time and allow you to look at that before you take us out. I just can't believe how time has flown.
Yeah. Let me say, it's interesting that people, when they're motivated, that means they have a motive.
Yes.
They have a charge, as we used to say in the church, a charge to keep I have, a God to glorify, and every dying soul to save, to fit them for the sky, to serve this present age, my calling to fulfill, may it all my power engaged to do my master's will. We're motivated. We have hope. We are resilient. We have faith. We have encouragement, and we're engaged, and we are hardened and challenged and caring and respect and blessed and equity centered. I love that word right there.
Even the little words are motivational.
They're
even
powerful,
the little words
knowledgeable,
are
and softened. Right? Think about that. You know, people are hardened, but they somehow this conversation, this authentic conversation has softened them to the point that they are open to, receptive to new things, and encouraged. Yeah,
even less anxious. We talked about the anxiousness at the top of the hour.
Right.
So we're on to something. I'm motivated. Absolutely. I'm encouraged.
Right. Absolutely. I am as well. I'm motivated. And each one of you, and I want you all to know, you see Dr. T and myself up front, but you all encourage us. You motivate us. You inspire us. And so we are so appreciative to each and every one of you for everything you do, both seen and unseen. And we are going to be in this together because we are in this together, and we're not going to let it go because it's too important. Right? The work that we do is too important. And even as we've gone through our vicissitudes and our challenges, right, we're taking our pain and turn it into purpose, right? Because that's what we're doing. You know, many of us have lost loved ones.
That's right.
Doing this COVID thing. I was just sharing my mother's best friend. She was like an
Yes.
aunt, right? Died 2 days ago of COVID at
Yes.
96. You know, and so we're going to keep our shoulder to the wheel and make it happen. Dr. T, look like that's going to do it for us, man. Do you know we got just 1 minute left for Dr. T and for the leadership, man. Thank you for what you do to Meg and the tech team. Meg, just give Meg some snaps for her public health minute and laying out the history of public health and how all of that interface. That was incredible, Meg. Thank you.
It was.
Thank
And
you.
Mayor, I wonder if I could do one more plug in the seconds we have. And Meg, do you have that barbershop storybook?
Yeah.
I want people to know, because this emerged out of the conversations that we've had here, breaking it down where the cows can get it, as Americans would say. But there will be a professional reading of the barbershop storybook on Monday at the Woolly Mammoth Theater. And it's just going to be amazing. And we're going to hopefully one day bring this show to all of you out there. Mr. Mayor, I'll throw it back to you.
Well, you've just done all we need to do. We're going to make that the last word for this segment of The Cutting Edge. And as always, I like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this: you got the power. Until the next Cutting Edge, take care of yourselves. You owe it to yourself. Bye-bye.